Okay, well, this is my conflict of interest. I don't have any conflict, in fact, for this kind of topic. This is a problem that is around the world. My country is not out of this situation. 60% of all Argentina have overweight. But as you know, obesity is not the same as localized obesity because it's the accumulation of fatty tissue in certain areas of body that generate anxiety and are resistant to solution with diet and exercise. Fortunately for all us, because it means work. Only to give you a little help, please try to, this is ideal patient, the one from the left, try don't doing nothing from the guy from the right because this is obesity in the visceral area. They need exercise and diet for sure. When you mention transdermal fat reduction, our objective is the apoptosis, the suicide of the fat cell. There's difference between necrosis and apoptosis. In the first one, there's inflammatory reaction because of a cell rupture. Instead of apoptosis that without inflammatory response because only is to induce this suicide cell. Hi. There are many technologies that look for this kind of result, cryolipolisis, radiofrequency, microneedles, focused ultrasound, cavitation, and lasers. And there are different kinds of objectives in this treatment, depends on the device. Cryolipolisis, radiofrequency, laser looking for the apoptosis instead of microneedle, HIFU, and shockwave that is looking for the cell rupture. We are talking only about cryolipolisis in this moment. There are many kinds of devices in the market. This is the brilliant mind behind all this. Ross Anderson, medical doctor, dermatology, and bioengineer at the same time. He published this article in November 2008, in which I want to read it, based on the principle of cold-induced paniculitis, where lipid-rich tissue are more susceptible to cold injury compared to the surrounding water-rich tissue. Cryolipolisis release on cold-induced apoptosis of fat cells, translating to a measurable fat reduction. This is a step-by-step what is going to expect when you treat a patient with cryolipolisis. We reduce the temperature below 0 centigrades during a period of time. After that, we're looking for a damage of the fat tissue, but without the damage of the interface that is skin. And gradually it's going to be eaten by our macrophages and thrown away by the urine. Many numbers that put us in an update that no less than 500,000 of non-invasive treatment performed in the USA of many kind of devices, laser, HIFU, and radiofrequency. And nowadays only are talking about cryolipolisis with the principal device. The principal device on the market is more than 8 million cryolipolisis treatment until today. There's really no data of the other market devices because they don't share the data. This is all the area we can perform using different kind of applicators or handpieces. And this is the classical contraindication, cryoglobulinemia and paroxysmal hemoglobinuria. I had the opportunity not only to meet the guy, the brilliant guy, at the same time have the opportunity to work with him. In 2017, in Argentina, I worked in a diodo laser to 1210 nanometers, trying to reduce and induce the apoptosis in transdermal way. Well, finally, we mentioned this, we present this article in AES LMS 2019, but finally they decide don't still work in this device. And finally here, the complication. In one side, the side effect, frontally are temporary as bruising, swelling, erythema, pain, transitory decrease of sensation, prolonged fibrosis of the fatty tissue, and vasovagal reaction. But on the other hand, the complication is going to still forever. Burn, frostbite, fat necrosis, skin necrosis, blood thrombosis, crystallization of fatty tissue, permanently decreased sensation, and paradoxical hyperplasia. And put that in image. Blister, excessive of fat reduction, hypopigmentation, hyperpigmentation, and one of the worst is the paradoxical hyperplasia. Here is the classical image of the frostbite, blister. And there are many groups of colleagues that try to share our complication in Facebook, Instagram, looking for a solution. This is a colleague from Spain to looking at a solution for this permanent hyperpigmentation. And I write to him, to her, that is well permanent. We can apply clobetasol, any kind of atopic solution, but it went to the melanocyte. It was killed by the cold treatment. That's why this hyperpigmentation is going to be forever. Like these cases, hypo and hyper in the same area, and you know, perfect the applicator or handpiece over the area. I said that is no solution. This is another patient directly sent to my office, trying to, I use the CO2 in the inner part, I use the Q-switch in the lateral part, trying to mimetic this hypopigmentation. Unfortunately, the patient don't continue with the treatment. There are many cases published in the you can look for this kind of complication. I select part of them, severe frostbite complication after cryolipolisis. I select this one because the medical doctor take account and like in a story, he tells us day per day the evolution of this complication. Here is on day 2, here is in day 8 with the first. We was many times to the surgery room, and this is the first surgical toilet. After that, was have an infection. Here you can see the fat because there is any skin over it. And again, necrosis because it is, we mentioned in Spanish, scara, and again, all cross or scab over the area. And finally, after a year, this is the result with the surgical procedure, reconstructive surgery procedure. A strange case published in HGPAs. I was the reviewer of these cases. I said, we need to push that because it was a fat necrosis, but inside the skin looking perfectly, but the patient touched something like a novel. And when they finally cut it, they found this fat necrosis inside the patient. I put all the QR. You can take a photo and download for free all these papers. Another paper, the first paradoxical adipose hyperplasia, was report for Ross Anderson, of course. And it's important that still at this moment, he didn't know what is happened. He published the articles, he mentioned what is step by step the problem, but even the more clever guy that I know in the world didn't know what is happened. My experience, someone sent this patient to me. I performed twice procedures, twice liposuction. I don't have any kind of solution on him. I lost the patient because it's like, it's really, you pass the cannula inside the wound. There's a lot of fibrosis. It's really difficult to solve. And many cases like this finally go to a dermolipectomy. As I mentioned this is a PRS report for my colleague for USA. Again, free download, here is the QR. And at this moment, they find that a total of 15 paradoxical hyperplasia over 11 patients. In these cases, 7 of them need a surgical procedure and 1 of them dermolipectomy. Not only that, 3 of these patients need a second procedure because with only 1 liposuction, it was impossible to solve. They are a common, it's more common in men. This is true in all the series appear. Here is about the rate. Usually the company said there's only 1 every 40,000 cycles. It's not patient, it's cycles, because in some patients it's more than cycles, reduce the average of possible complication. And at this moment, the ratio of this publication is 0.72, close to 1%. And this is one of the cases they try to solve. Here is before, after the paradoxical hyperplasia, and doing the liposuction, the patient is worse than when she started the procedure. Again, here is the QR to share with me this last publication in 2024, a group of colleagues looking for many making research of many publications talking about this problem, and where they found that the incidence is more than they usually said. This is 2%. It means 1 in every 50 cases. More, of course, again, on male patients. And the solution, they add the succinylcholic acid, but usually it's liposuction or dermolipectomy. And they think about possible mechanism or action of this situation. And they mention adipocyte of persistent hypertrophy, recruitment of pre-adipocytes, reduction of sympathectomy innervation, change in receptor expression and signaling factor involving in adipocyte metabolism, hypoxic injury or negative pressure suction. Maybe in the future, if you try to look a solution for this hypothesis, maybe in the future we can obtain a reduction of this kind of problem. And finally, these cases that a patient think that was successful, but share the problem, the colleague in this internet network of surgery, plastic surgeons, and looked at was terrible the way that this applicator eated the fat, because create like a step. And even in one hand of plastic surgeon, it's impossible to solve. I need perform 2-3 lipofilling trying to solve that. Fortunately, it's not my patient. Fortunately, I never be to handle with that. Finally, my take-home message: complication. At the moment, there's a complication insurance of $4,000 US. It means that this complication is going to appear. Is 2 plus 2 is 4. So if they give you this amount, it's because they expect more complication like this. Remember that the only solution is by lipoaspiration or dermolipectomy. Finally, complications are not rare, and they leave severe sequelae. Very inexpensive equipment with less technology are the responsibility of the majority of the complications, are the burn and the frostbite and the hyperpigmentation. But the specimen equipment are the responsible of the paradoxical hyperplasia. This is finally less technology, more burn or frostbite, more technology, more paradoxical hyperplasia. Finally, technology for eliminate ultra-thermal fat have proven effective. A lot of them are safety. Study the market, read, search for literature, and attend course and conference before deciding on one of these technologies. And it's important to know that all technologies are harmless, and it is mandatory to explain this possibility complication to your patients. Finally, I invite all of you to the city of Bogota in August. Between 15 and 17 is going to have the Melasma Congress. We talk about all type of pigmented complications. Thanks so much.